Today we are going to be talking about stem cell therapy for vision, diabetes, nerve damage, and what really works. What if the future of treating blindness, diabetes, or nerve damage didn't lie in just pills or surgery, but in your own body's healing potential? That's the promise of stem cell therapy. So, what exactly are stem cells? They are the master cells that can become anything in the body, like retina, nerves, blood vessels, even insulin producing cells. Let's explore how different types of stem cells are helping treat serious diseases, especially genetic eye diseases, diabetes, optic nerve damage, etc. So, to name a few types, the best of them are embryonic stem cells based on the source. Embryonic stem cells, early stage embryos, they are lab derived as well, and it helps in retinitis pigmentosa, Stargardt's disease, age-latent macular degeneration, which is highly potent, and it's rarely used in India. And the second one is mesenchymal stem cells. They are derived from bone marrow, adipose tissue, umbilical cord. They're used in diabetic retinopathy, macular degeneration, optic atrophy, stroke, anti-inflammatory, immune modulating diseases. And induced pluripotent stem cells are another condition. They are reprogrammed adult cells and they help in retinal regeneration, optic nerve repair, and this is a Nobel Prize winning technology, and it's custom made patient to patient. Limbal stem cells in the eye from the limbus, that's corneal junction, they are used for corneal blindness, burns, and it is LSCDA approved, and it's successful in India. It's approved in India. Hematopoietic stem cells are from bone marrow, peripheral blood, and it's used for diabetic ulcers, ischemic injury, systemic inflammation. It's less used. And in the eye, for immunity, for blood related problems in the eye, it's used. And neural stem cells are another area where it's from the brain tissue, induced pluripotent stem cells, derived optic nerve atrophy, and for brain injuries, it's in experimental stage, but it is promising. So, eye conditions benefiting from stem cell therapy are it's the eye diseases based on the delivery route. For retinitis pigmentosa, the iPSC, induced pluripotent stem cell, or MSC can be given intravitreal or in the subtenon's route, and also retrobulbar. It regenerates photoreceptors, and in macular degeneration, dry and atrophic macular degeneration, induced pluripotent stem cells have been used, or umbilical mesenchymal stem cells have been used as well in some studies, and they've used it subretinally as injections, and it regenerates the retinal pigment epithelium. Stargardt's disease, either embryonic stem cells or induced pluripotent stem cells, and they can be given subretinal subtenons, and visual restoration has been shown in some studies. Diabetic retinopathy, mesenchymal stem cells have been used, adipose tissue and umbilical cord source, and intravitreal, it reduces inflammation and vessel repair. In retinal vein occlusion, artery occlusion, bone marrow derived mesenchymal stem cells are used, and hematopoietic stem cells intra-arterial are also given, or intravitreal. They revive the ischemic tissue. And optic atrophy because of glaucoma, trauma, neural stem cells are being used. MSC also are being used, mesenchymal stem cells, and they are given either retrobulbar or optic nerve sheath. So how is it given? As I told you, subretinal for replacing photoreceptors, RPE cells, intravitreal for inflammation control and vessel repair, retrobulbar for optic nerve sheath injection, for optic nerve damage, IVs, systemic IV, it is given diabetic patients post-stroke and neuropathy. Why umbilical cord derived MSCs are popular? It doesn't have ethical issues, non-invasive collection, it's got anti-inflammatory and neurotropic properties, can be expanded easily in the labs. So, very important note, not all stem cell centers are the same. Ensure treatment is from a GMP lab certified personnel and follows ICMR or DCGI guidelines, and these guidelines uses screened, tested, ethical sourced cells. So the bonus tips for best results are combined stem cells with hyperbaric oxygen therapy, photobiomodulation, vision therapy, third eye yoga, gut microbiome, and the supplements which we give. So these are really working well. Stem cells are not magic, but when used in the right way, they awaken your body's deepest healing potential. From saving sight to restoring nerves, the future is already here. Stay tuned for real patient stories from Dr. Sashi Eye Care. Thank you.